Hi everyone, my name is Kimberly Limon. I am a part of Group 7, which also includes Michelle Maldonado, Brian Uribe, and Elaine Lugo. We will be presenting on Chapter 10 on the topic of psychological maltreatment of children.
Hello, all. I will be introducing our concept, and as defined by our book, psychological maltreatment, so PM, is a repeated pattern or extreme incident or incidences of caretaker behavior that prevent the child's basic psychological needs and deem them worthless, defective, damaged goods, unloved, unwanted, endangered, expendable, and/or primarily useful in meeting others' needs. To provide a little bit more context, I will be explaining the psychological needs. To begin, cognitive stimulation. Those are techniques, strategies, and materials used to stimulate memory, attention, language, reasoning, and planning, among others. Moving on to the second is emotional and social support. That's encouragement, reassurance, and compassion. They can be verbal or they can be physical gestures. Third is respect. That's a way of treating or thinking about someone other than yourself or something else. And safety, averting injury, danger, or loss. And lastly is socialization. It's learning the norms and values of society. Lastly, is that psychological maltreatment is a component of all forms of maltreatment. It includes acts of commission, omission, and neglect. Acts of commission, for example, are threats by a caregiver towards a child, and acts of omission are repeatedly ignoring a child's bids for attention and or comfort when distressed. Thank you for your time. Here's Michelle.
Hello everyone, my name is Michelle Maldonado and today I am going to be covering slide number 3, the role of human services within psychological maltreatment. The first bullet I wanted to cover is that professionals are assessing children for possible effects of psychological maltreatment will find the IDEAA definition of emotional disturbance useful in guiding. The IDEAA states that psychological maltreatment incorporates a major mental disorders and interpersonal, cognitive, emotional, and behavioral problems within children. Human services workers are the first to decide whether psychological maltreatment is occurring in the home. If it is present, the first thing that they want to make sure is that they have the level of security that needs to be addressed within that child to make sure they are safe. Now, I wanted to cover how children can experience one or more physical signs of psychological maltreatment in forms that can occur together or they can be disconnected, which is important why human services have the IDEA definition of what it means to be psychological maltreated within that child to make sure they are not guiding what they're trying to protect that child from or any roles that they play within. Also, I wanted to cover how California mandated reporting indicates that any child who is physically abused, sexually, or neglected is emotionally abused, which indicates a little bit more about what psychological maltreatment goes within. And it is important that human services workers need to identify the psychological maltreatment impacts and consequences with that child so they can prevent it or be taken away from that situation. I believe it is important for human services workers or the community to make sure they are diagnosing or looking out for signs of psychological maltreatment so we can prevent so the child can have a better quality of life and just making sure that they are taken away from that hostile environment. Thank you.
Hello everyone, my name is Brian Uribe and I'll be talking about slide 4. The French Catholic Church abuse report is the current event that I'll be talking about. The French Catholic Church is engulfed in a major scandal due to the publication that reported on 70 years of sexual abuse by both clerics and lay people. And lay people are just members of the church for the Catholic organizations. An estimated 330,000 children were abused, mostly boys, and at least 3,000 predator clerics, most of whom are dead, which does not include lay abusers, meaning that the number of predators would have been much higher than 3,000. This can be connected to psychological maltreatment because, as we know, sexual abusers not only engage in physical harm, but as well as non physical harm. For example, shaming, threatening, exploiting, corrupting, betraying the child's trust are all characteristics of sexual abusers as well as psychological maltreatment. We can assume that a large portion of these children were psychologically abused as well, which some potential effects of that are depressive disorders, anxiety disorders, suicide attempts, drug use, and a greater risk for adverse mental health outcomes. And now I'll pass it over to Kimberly.
So to conclude and our takeaway, we got that psychological maltreatment, also known as PM, may be the cause of the majority of human suffering, which has occurred throughout history. We also got that human services worker gain adequate understanding of psychological maltreatment to further illuminate the inadequacy of the majority of corrective interventions applied to violence and maltreatment against children. PM can cause problems of the interpersona, so this includes anxiety, depression, negative self-concept, and negative cognitive styles. It also causes emotional problems, so this can include substance abuse, eating disorders, emotional instability, impulse control problems, and borderline personality disorder. It also causes social competency problems and antisocial functioning. So this can include social phobia, impaired social competency, lack of empathy for others, self-isolating behaviors, and aggressive behavior. Also, it causes learning problems and behavioral problems, so which includes impaired learning, academic problems, and lower achievement test skills. Also, decline in IQ over time, and also lower measured intelligence. And lastly, physical health problems and adverse biological changes. So it includes delays in almost all areas of physical and behavioral development, so which includes allergies, asthma, headaches, and sleep complaints.